All right, so now I'm proud to introduce my friend and my colleague, Laurie Brown. Very happy about this, Miss Laurie. Anyway, Laurie is Chief Compliance Officer for American Vascular Associates, and she's had 17 years of leadership with clinical operations, and she's a nurse. And she loves compliance as much as I do. So without further ado, I really do want to turn this program over to her because compliance, what she's going to talk about is one of those trickier things. So let's turn it over to Laurie Brown. Enjoy the program.
Good morning, everyone. Thank you, Marcy, for that lovely introduction. And thank you for all the sponsors that have invited all of us to speak today to all of you. I'm going to see if I can share my screen here and we'll get started. Hopefully everyone can see my screen. Today we're going to talk about compliance. It's not everyone's favorite topic. We're going to talk a little bit about the basics of a compliance program and what you can do for your practices to ensure compliance. Okay, today we're going to learn a little bit about what the compliance program is about, the code of conduct, laws that govern healthcare compliance, the elements of a compliance program, who is the compliance officer, and what you can do in your practice to promote compliance. And hopefully this gives you a sense of awareness of the laws and what a compliance program is all about. The healthcare compliance program is required by law. It regulates your billing and your coding, prevents improper treatment and billing, and protects your organization or your practice by following all the laws and regulations. We've all seen headings. If you're in the healthcare field, you hear and see different headings regarding different legal matters that have come out of the Department of Justice. And it's not only just for practices or organizations, there also have different investigations and outcomes regarding individual providers. So these are just some of the headings that we see that come out on a daily basis from the Department of Justice regarding non-compliance with regulations. Compliance and ethics. What is compliance? In its simplest form, compliance means following a rule or request. In healthcare, we talk about compliance. We refer always to rules and regulations, policies and laws, which are created by the government, insurance programs, and payers. What is ethics? Ethics simply means doing the right thing all the time, and it goes beyond what is allowed by laws and regulations. What is a company's philosophy or a practice's philosophy regarding compliance and ethics? Well, we expect that the company or the practice is always going to comply with applicable federal laws, regulations, and standards. We know that everyone doesn't always have the intent to be dishonest, but we all have to make sure that we are fully aware of the rules and the regulations. The compliance program, what does it consist of? It's established to assist an organization in promoting their commitment to the highest legal and ethical standards. The program commits everyone at the company, including partners, senior management, your physicians, employees, even your vendors, and anyone else that is associated with the company. The program allows you to provide education, conduct investigations promptly where there are allegations of misconduct, and take part in monitoring activities such as audits, assess areas of risk. So those risk assessments are very important. This program provides a proactive approach to comply, therefore helping to maintain an organization to maintain its commitment to the highest level of compliance and ethical standards. And compliance is part of all of our jobs. It's not just the compliance officer. And we depend on everyone in the organization or the practice for a successful program. So what are the elements of a compliance program? The government, the Office of the Inspector General, actually outlines this for us. And I've actually provided two links for your reference. The first one at the top of the screen is the actual link to the OIG that talks about the compliance program. And the compliance program includes 7 elements in order to be effective. So the first element, you need written standards of conduct and policies and procedures that promote a commitment to compliance. You need someone as a compliance officer or a designee, someone that is designated to oversee the program. You also need to have compliance education and training for all your new hires and also annually and that includes your providers. You need processes in place to receive anonymous complaints and allow complaints from employees and providers without fear of retaliation. And one of the examples I give is a hotline, and there are many other different choices. Responding to all the allegations of improper activities, and when necessary, developing a corrective action plan. Auditing and monitoring on a regular basis to identify potential areas of risks. And we'll talk a little bit more about auditing and monitoring. The investigation and remediation of identified systemic problems and non-employment or retention of sanctioned individuals. And what does that mean? That means you want to go to the link that I provided and you want to make sure that the providers that you are bringing into your practice or the individuals you're bringing into your practice or the vendor is not listed on the OIG's exclusion list, meaning they cannot participate in practicing or billing of Medicare or federal healthcare programs. Compliance policies. So as required by the OIG, the company has policies and procedures in place to ensure compliance with laws and regulation. Having good policies in place helps you to mitigate some of your risks and allows the OIG, if you're ever audited, to see actually what your processes are. And it actually creates a little bit of organization out of chaos sometimes. So we're going to talk a little bit about code of conduct. And these elements are all part of the code of conduct document that you should have in place. So quality of care and services. You want to talk about, the commitment is to improve the health of the community that you serve. Privacy and confidentiality. Fulfilling regulatory standards, keeping information safe, secure, coding and billing integrity and record keeping, documenting, making sure you're documenting what you're doing for each beneficiary. Customer service. You want to apply customer service standards, which are your core values, to every interaction with every individual at all time, and your focus is on serving your patients and their families. Compliance with laws and regulations, requiring all staff members to conduct their individual duties and all operations in a manner that meets the applicable legal, ethical, and regulatory standards. Workplace conduct and employment practices. You want to create an environment which employees and physicians feel comfortable, respected, and given opportunities for development. Research, following ethical standards when you're conducting research. By either the physician or other staff in your office. Conflicts of interest, regulating activities to avoid conflicts of interest, actual impropriety and or appearance of impropriety. And you want to add that you have protection of property, assets, and information. So code of conduct. When at times you're sometimes presented with difficult situations, you're not sure how to approach those situations. So as you are approached with a specific situation and you consider possible actions, there are some questions you might want to ask yourself. Is there a law or regulation that governs the situation? If there is, then the law should be followed at all times. Do you have an internal policy that governs the situation? Would your actions be consistent with the company's commitment to the highest ethical standards? Are you following your own policies? If you have it written in your policy, you should be following it. How would my actions be seen by someone outside the organization? Would I feel comfortable explaining my actions to friends and family, or even the government? What would the most ethical person do in that situation? You always want to do the right thing. We've all been tempted to take the easy way out sometimes, and it may not be the best way. So you want to try and avoid creating excuses for behavior that doesn't meet your code of conduct that you have in place. So some of the excuses I consistently hear is, well, the other centers are doing it this way. No one will ever know. I don't even have time to do it the right way. I saw my supervisor doing it the other day, so why should we have to do it? That policy wasn't meant to apply to me. And after all I've given this organization, I deserve something in return. So if you come up against some of these situations and you're not sure what to do, there are always other resources available, hopefully, in your organization. Either a supervisor, human resources department, your compliance committee, if you have one, or a chief compliance officer, or someone who's designated as the compliance person. You may even have a compliance hotline in place, or a general partner, or a board. Medicare and Medicaid abuse. We're consistently seeing in the headlines about abuse and how it results in unnecessary costs to the government and is inconsistent with the goals of providing patients with services that are medically necessary. So the Deficit Reduction Act of 2005 became effective in January of 2007. And the basic premise for this act was that it applied to organizations that make or receive 5 million or more Medicaid payments in a fiscal year. And the organizations must provide clear guidance to employees and business partners about the False Claims Act. Applies to all employees, medical staff, vendors, and contractors. And your employees, medical staff, vendors, and contractors have the right to report false claims against Medicare, Medicaid, and other healthcare insurers. Now, you might be a small organization, say, well, that doesn't apply to me. But the government has made their expectations very clear, and excuses for not having such a program in place could be harmful to your business, but ultimately the patient, because if something happens to your business, the patient has nowhere else to go, and especially if they enjoy coming to your facility. Congress, I put the link for the Deficit Reduction Act in the slide for you. The Affordable Care Act of 2010, this law reiterates the government's expectations about compliance programs. And in that act, sections 6102 and 6401 state that healthcare providers that are enrolled in Medicare, Medicaid, and the Children's Health Insurance Program must adopt compliance programs as a condition of their enrollment. So this is where the government expects healthcare organizations to have a compliance program. Now we're going to talk a little bit about some of the other acts that you monitor as a compliance officer or the designated compliance person. The HIPAA Act. This rule establishes national standards to protect an individual's medical records and health information. And I'm sure we're all very familiar with this, and I'm sure we've all had lots of training over the years on HIPAA. So we know that it applies to covered entities, health plans, providers, clearinghouses, anywhere that you have protected health information for patients. And this rule sets limits and conditions on the uses and the disclosure of this information. And it gives patients rights over their health information, including rights to examine and obtain copies of their medical records. And I provided a link for you. Healthcare fraud and abuse. So we talked a little bit about some of the issues with healthcare fraud, and here's some more to talk about. Generally refers to intentional deception that could knowingly result in benefit to the individual or organization. Some of the examples: billing for services or supplies not furnished, signing blank records, falsifying information on records, offering bribes or payment or incentives in exchange for healthcare referrals, misrepresenting services as covered and medically necessary when they are in fact not, and assigning diagnosis and procedure codes based upon coverage requirements and not based on your actual services that you've provided to the patient. And then we have healthcare abuse, so charging excessively for services or supplies, providing services that do not meet professional standards, and billing Medicare as primary when it's truly secondary. So these are some of the examples. The False Claims Act. So this act imposes liability on anyone who submits a claim to the federal government, which he or she knows is not true or accurate. An example could be a physician that submits a bill to Medicare for medical services he knows that he didn't provide. It could say he could bill, for example, an ultrasound. He never provided an ultrasound. It's not documented anywhere. The False Claims Act also imposes liability on an individual who knows that a false record submits a false record in order to obtain payment from the government. And an example of this includes a government contractor who submits records that he or she knows is false and indicates compliance with certain contractual or regulatory requirements. Another area is the liability includes those instances in which someone obtains money from the federal government, which they're not entitled to, and then uses false statements or records in order to retain the money. So an example of this is the so-called reverse false claim, which may include a hospital who obtains interim payments from Medicare throughout the year, and then knowingly files a false cost report at the end of the year in order to make a refund to the Medicare program. And if you've ever been or read any documents related to false claims, noncompliance, we know that there are stiff penalties for these violations of the False Claims Act. And in the end, it could result in exclusion from these programs. So conflict of interest and anti-kickback. So conflicts of interest exist when you or a member of your family work for or has a financial relationship with an entity. So a company that you do business with or seek to do business with or competes with the company. Anti-kickback. No employer or provider may take, offer, or give anything to or from a physician in exchange for the referral of patients. Billing and coding. This is another area and is a highly important area to focus on as a chief compliance officer. Documentation. We know that Medicare's rules for billing, if it's not documented, it didn't happen. And it's actually based on services that are actually rendered. So your medical documentation needs to include many different pieces. So dates, what the physician did, the past medical history, and we know that those items need to be present in order for it to be complete and for medical necessity to be confirmed. And we also want to make sure that it's very legible. And with electronic health records, that helps, tremendously. And all your tests that you perform should have some type of documentation or an order to support the necessity for performing that procedure that you're doing. Penalties. We know that if an organization or a person is found to be in violation of fraud, waste, or abuse, or in violation of any other of the healthcare regulations, the penalties can be severe. And some of the penalties I listed below are disciplinary action up to including termination from and exclusion from the participation in the Medicare and Medicaid programs. There are fines. We know that the government can now issue treble damages, which means up to 3 times the amount that they have decided that you have to pay. There are jail sentences for employees, administrators, and physicians. I also provided a link in the slide to give you further information on, what the outcomes of noncompliance are. A little bit about monitoring and reporting. Companies continue to review business activities, and you want to make sure that your employees and your business processes are in line with laws and your actually established policies. So some of the ways that the company monitors activities include performing background checks on new associates and providers, auditing departments to ensure they are following established policies and procedures. And that's very important. Making sure that you have establish auditing and monitoring processes, who's in charge, who's accountable for those. The compliance officer always wants to know who is doing the audits, how are you performing the audits, and how often. And then working with the different departments to make sure that everything is in line, and actually offering support to them if they have to complete a plan of correction. Also, sanction screening. We talked about the exclusion list. So you want to make sure that employees and affiliated persons are eligible to participate in the Medicare and Medicaid programs. Employees should be encouraged to first talk with supervisors or whoever the normal chain of command is when there is a compliance issue. We always encourage that, whether it's through a hotline, your training, initial training or annual training. And we also want to promote non-retaliation. So no one really should be punished or terminated simply for calling a hotline or reporting a compliance-related program. And it's important to keep track of those complaints as a compliance officer and ensure that the person that is submitting the complaint has the opportunity to submit it anonymously or come to you. And it's very important to have a really good relationship with your HR department. HR crosses over in so many of the compliance policy and procedures, and they can definitely be a super duper ally for you. So what we're going to be talking about a little bit about is education and training, things that you can do to make sure that your teams are up to date on the current compliance rules and regulations and what they can do to ensure compliance in their department. So we always like to do initial training upon hire and annually, and that's very important because everything, there are rules and regulations that change pretty regularly, and we want to make sure that everybody has the current information. You want to make sure you're reviewing any new or updated policies and procedures. We like to do that at least annually. Periodic updates on changes in healthcare laws and regulations. Identifying opportunities for improvement related to medical record documentation. You want to safeguard your patient's protected health information. Are you up to date? Do you have, are you sending emails that are, protected, that contain patient's information? How to report complaints related to compliance. Do you have a hotline? Do you have a designated person that your employees or your physicians can go to? How do you address those complaints related to compliance? Your teams need to understand, that when you submit a complaint that you're gonna review it, and within 24 hours you're gonna get, a first message out to the person who filed the complaint to say, we're looking into it. Are they closed within a reasonable amount of time? With an outcome. Maintaining compliance through periodic audits and monitoring. And are you creating plans of correction for any identified risks or deficiencies? That's very important. If you all have, I'm sure, have been through surveys and are very familiar with plan of correction. For your investigations, all reported concerns will be reviewed. You want to make sure you're documenting them. Any suspected violations brought to the attention of management will be promptly and reported to the appropriate parties. Who is assisting in resolving the problem? And then all reported information will be kept confidential and only shared with those individuals who need to know in order to conduct an investigation to correct the situation or as required by law. So, working with different companies, we know that the chief compliance officer is not the most respected or valued person in the organization. And some practices or companies, don't really see what the value is of having a compliance person. So having a compliance person or officer is really valuable because they actually complement all the different departments. They can work with your operations team, they work with billing and coding, they work with your finance team, they work with your executive team. And what we try to do as the compliance department is to help to advise your leadership. We provide consulting. We can work with helping you train your employees about compliance. We do all the investigations related to potential violations, and we try to be involved in a lot of the meetings to help mitigate some of the identified risks, especially when you are working with the executive team and trying to help them understand if that partnership with a physician is compliant. We also work very closely with legal, and whether you have an on-site legal counsel or you engage an outside legal counsel, the compliance officer or the designated compliance person works very closely with legal, because we are not lawyers, compliance officers. Some of us are, but the majority of us are not, and we don't pretend to be. So we always rely on our legal colleagues. Proactively auditing your operational activities to guarantee compliance with your policies and procedures. So billing, are we looking at specific reports on a monthly basis? Are we identifying trends? Is this, process that they have in place compliant, and is it in line with the policies and procedures that you have created? Maintaining a separation of responsibility, that could be considered operational in nature. Providing audit oversight for a program in which one also shares or directly manages daily operational activities can present new challenges or gives the perception of a conflict of interest. I always say I cannot be the compliance officer and your regional director. I can't grade my own paper. I cannot make these decisions on the operations side and be the compliance person that actually audits those compliance operations. So some of the goals of a compliance officer is preserving the value of your organization or your practice, protecting the organization or practice. We want to prevent, detect, and deter fraud and other wrongdoing. We also want to make sure we're conforming with many of the regulations, OSHA, HIPAA, Stark, AntiKickback, False Claims Act. And that's a huge challenge. We are the person that wears the many hats, and we are very much involved in many different departments of the organization. And we are welcomed in some of those departments and not so welcomed in others. We want to create value for your company. We want to be involved in your initial discussions versus after the fact. We want to be proactive versus reactive. We want to provide guidance on ways to accomplish your goals within the confines of the law. We want to enhance your operations. We want to help you look at your processes. We want to try to avoid penalties, and we want to try to avoid and mitigate risk. So how can you maintain compliance? First, you need to embrace change, and change is hard for everyone. You also want to know your policy and procedures and be sure you're practicing in accordance with them. Follow your gut. If something doesn't feel right, talk to your supervisor or take it up to up your chain of command. We also want to make sure that all your documents containing patient information are secure. We don't want to leave computer screens open for everyone to see. We don't want to leave papers with patient information laying around where vendors can see. So we want to be mindful also about discussing patient information where there are patients and family members. And if you have a question, you want to seek help. Compliance person, compliance officer, if you have legal counsel readily available, those people are definitely your resources. And you want to stay educated and informed. There are lots of listservs that you can join to get up-to-date information regarding compliance in different states. These are some of the quotes that I live by as a compliance person. If you think compliance is expensive, try non-compliance. It kind of gives me some motivation when I look at these quotes. It's not just about being better, it's about being different. You need to give people a reason to choose your business. And if patients and referrers know that you put yourself at a higher level and of living up to quality and standards, they respect that and they want to refer to you. It's not your customer's job to remember you. It's your obligation and responsibility to make sure they don't have the chance to forget you. And just always remember, compliance begins with you. And that's all I have today. And I thought I would leave some time to open this up for some questions if there are any.